Hello, everyone, and thank you for joining us at the virtual groundbreaking ceremony for Texas Children's Hospital in Austin. I am beyond thrilled that we've reached this milestone and extremely proud to expand our footprint in the state capital.
For the past few years, I've had the privilege and honor of working alongside a remarkable and dedicated team of individuals who spent tireless days, month after month, ensuring that Texas Children's could seamlessly expand our care to Austin, Texas. In 2024, we will open our 365,000 square foot, 52-bed hospital campus in North Austin. The same high-quality inpatient and outpatient health care that we have provided to our patients since 1954 will now be a part of the Austin community.
We already have primary care, subspecialty care, and an urgent care center in place. And now we are bringing exemplary inpatient care, pediatrics, and OB-GYN to Austin and Central Texas.
Our promise from the very beginning of this journey into Austin has been to deliver the highest quality care closer to our patients through our multiple locations across the city so that children and women can access the right care in the right place at the right time.
There's going to be a seamless continuum of care throughout our facilities here at Texas Children's for primary care, outpatient specialty care, and for North Austin Hospital location as well.
With each new location, and now with the Texas Children's Hospital campus in Austin, we have the ability to expand to more and more women and children who need our world-class, one-of-a-kind care.
Hey, this is Tex, and he has hypoplastic left heart syndrome.
I'm Caitlin Rowley. I recently graduated from the University of Texas, and I am a Texas Children's patient.
When my twin boys got sick a few years ago, we had to search everywhere for a specialist that could figure out what was going on. Lucky for us, one of the best children's hospitals in the entire world was just a few hours down the road on 290.
When we got the diagnosis, we knew that as parents, the only thing that we could do to influence the outcome is pick the place that's the best. And that's why Texas Children's Hospital is Texas Children's Hospital.
Living with a severe chronic illness, I was at Texas Children's in Houston all of the time, and I received the very best care. So when I was asked to be a part of the Austin Family Advisory Committee, I was so excited that the Austin area would be getting a Texas Children's Hospital campus because I received the very best care there.
When I met the people at TCH and I saw the kind of care my boys were getting, I knew Texas Children's was something special. I realized pretty soon I was going to be making that drive a whole lot more, a few hours down 290, or sometimes I would do 71 to I-10 if I knew I wanted to stop at Buc-ee's. So as much as I'd like to pretend that it was some great selfless act for me to help TCH come to Austin, secretly I was just kind of hoping to not have to drive quite as much. But as I got to know more of the people at TCH, and as I got to know so many of the other families also here in Austin that make that exact same drive I do, I realized this was just a really good opportunity for our community.
For our little heart warrior, we only want the very best care, and Texas Children's is the best. We are so excited they are coming to Austin.
Yeah.
It is so evident that Texas Children's Hospital knows that quality is not just about surgical outcomes or readmission rates, but it's about the patient-centered care experience, and it's about making families whole again.
I've seen the care and effort that this team has already put into building a facility that's going to meet the needs of the people here in Austin, the parents and the children. And while we certainly don't need any more reasons for people to want to move to Austin, this is going to be a big win for our community and the surrounding Central Texas area.
The Austin community is growing so rapidly, and I am so excited that so many children and families will get to experience the incredible care that Texas Children's Hospital has to offer them.
I'm thrilled to be a part of this group of people. I'm excited to see this facility getting started. And I'm already concocting a plan to talk to a few of the doctors in Houston that are some of my favorites and see if they have any interest in moving out to the Austin area. You know, it is pretty nice out here.
We love Texas
Children's Hospital.
With Austin growing so rapidly, Texas Children's can provide a much needed choice and quality care to the area.
We all know that Austin is one of the fastest growing cities in the nation, and it has been an honor to figure out the best ways to provide the best care to this ever-growing population.
We're not only the largest children's hospital in the country, for the past 12 years we've actually been ranked as one of the best in the country.
Well, for me, I love living in the city of Austin, and I'm incredibly excited to be a part of an organization that's going to deliver access to some of the best pediatric health care in the world.
Number 4 overall, number 1 in cardiology and heart surgery, number 2 in neurosurgery and nephrology.
We have seen a preview of how our care exceeds the community's expectations from the patients and families who have walked through the doors of our Texas Children's Specialty Care of Austin.
When Texas Children's first announced that they were moving to Austin, I was thrilled. And I'm even more excited to be a part of the project that is bringing Texas Children's care and culture to Central Texas, not only today, but for decades to come.
I truly believe that Texas Children's is the best, and I'm excited to see us continue our mission to create a healthier future for women and children of the Austin community.
So what a great experience to be part of an organization that's bringing only the best.
When Texas Children's opened its doors in 1954, our founders envisioned a hospital that would serve all children in our community and give them the hope of a healthy future. Today, we treat children from all over the country and, well, from all over the world. And we want the children and women and families of Austin and Central Texas to have access immediately to the best pediatric and OB-GYN care in the United States and in our great state. And that is exactly what we are bringing to Austin and to the families who need us.
Good morning, everyone. Thank you so much for joining us for this celebration and virtual groundbreaking for Texas Children's Hospital in Austin. I am joined today by Dr. Larry Ollier, Texas Children's Surgeon-in-Chief, Dr. Jim Versalovic, Texas Children's Pathologist-in-Chief and Interim Pediatrician-in-Chief, and Yvette Shaw, Senior Vice President here at Texas Children's Hospital, who is leading the Austin expansion. Dr. Ollier, Dr. Versalovic, and Yvette, thank you so much for being here today. It is so exciting to finally meet this milestone in Austin, Texas. We've been planning for this milestone in Austin for a very long time. We often get the question, why did Texas Children's decide it was time to expand in Austin? Dr. Ollier, would you like to share your thoughts on that?
Sure, thanks, Michelle, and I appreciate being here. Well, why now? Well, I think it's no secret that Austin is one of the fastest growing cities in this country. And it's a relatively young population with many new parents. And to put it simply, Austin does not have the pediatric care that it needs today, and certainly not for what it's going to need in several years. And this is particularly true for the complex care, for the sickest children. For years now, so many of these families in Austin have actually driven to Houston for that care. We felt it was finally time to provide that care for them closer to home. And I think I can speak for everybody on this call. We are all very excited to finally be in our state's capital.
So, Michelle, why do you think that Texas Children's is the best place for families to receive their pediatric care?
Yvette, I think it's first and foremost the quality of our doctors and our surgeons that we will have at the hospital in Austin that sets Texas Children's apart from anyone else. We are the #1 children's hospital in Texas. We have some of the best and brightest clinicians in the world, and we provide quality care, high quality care to some of the most complex children and women. So I really think it's the fact that we're the best within our specific subspecialties. We have some of the best and brightest clinicians in their fields. We have innovators and pioneers. And we're so excited to bring this quality of care and the depth of the care that we're bringing to Austin to really add value to the care that already exists in Austin.
Yeah, I think I can just add to say that, as Michelle just stated, that we're bringing the very best in Texas to the heart of Texas in Austin. And the reality is that the state of Texas has one elite top children's hospital recognized nationally.
We will be able to deliver the sickest of babies and be able to transfer them immediately into the pediatric NICU. So we're excited to be able to offer that, where mom doesn't have to be transferred or baby doesn't have to be transferred away from mom right after birth.
You know, we're well prepared to do that. We have the largest team of maternal fetal medicine specialists in the country in our facility already, not to mention the largest group of pediatricians in any children's hospital in the country and the largest group of pediatric surgeons in any children's hospital in the country. And we're bringing that experience and those numbers to Austin.
Texas Children's will be there ready to provide the very latest and best outpatient care as well as sophisticated inpatient care, including ICU care with the very best in critical care medicine ready to serve our families in Texas.
You know, I think it's important to point out one special aspect of our care is just how collaborative it is. We have all of these experts, but they're not working in a silo. We all know that no one doctor or nurse can provide comprehensive care for a child. It takes a team to do that. And here at Texas Children's, we've assembled some of the most comprehensive teams that have ever been seen in the children's hospital. Not just doctors and nurses, but therapists and social workers, data analysts who actually help us track our outcomes to ensure that we're providing the best care that we can for these children, whether they're very sick or they simply need a well child check.
I think it's important also to mention, we know that the groundbreaking of our inpatient hospital is a next step for us, but we've been in Austin for the last 3 years and providing care to families across Texas. And we've really gotten such great feedback from our families of the access to care and being able to access the #1 heart center in the U.S.
Yvette, that's a great point. Another thing is that Texas Children's is committed to an incredible patient-family experience. And Yvette, I know you've been integral in the planning of the Austin Hospital, and you're working with the teams to make sure that we deliver the best customer service possible, and that we do create an incredible patient-family experience. Can you share a little bit about that process and what you envision in terms of the customer experience?
It's very focused on our family and really providing family-centered care. We know that time is precious and families need to be able to get back to their daily life. And so in the design of the facility, we really have tried to accommodate all of the needs in the inpatient, outpatient tower, as well as our retail core that families are able to access.
I can say without question that we deliver an unmatched experience based on years of building care centers close to home and backed by the knowledge that our providers have here. And I think we need to reinforce to people that we already have much of this in place in Austin with primary care pediatricians, urgent care, and specialty care centers. Our new hospital is going to allow us to provide emergency care as well as inpatient, acute, and intensive care, but we're getting there quickly.
You know, it's such a key point, Larry. We're providing and we are certainly delivering an integrated healthcare delivery system to Austin. Something Austin and Central Texas, frankly, the Hill Country region has not seen before. Nothing like this.
I think what's really exciting is that whether it's the breadth and the depth of the services we're bringing to Austin or the quality of care that we will provide or the excellent patient experience, it's what families love about Texas Children's, and it's what the Austin community deserves.
We're very excited about what we will be offering as a healthcare system and as a hospital in Austin. Opening in 2024, we'll have facilities that are ready for telemedicine. And I think another key point is this facility will be pandemic ready. We've learned so much in the past year.
And Jim, you know, a city as technologically advanced and focused as Austin is deserves a brand new technologically advanced hospital. And that's what we're going to be bringing to that community.
There's something very special about building a facility, knowing it'll have such a positive impact on so many children of Central Texas.
It means that I'm able to be part of a talented and diverse team of healthcare professionals, designers, and consultants who are all committed to delivering an exceptional project to the North Austin community.
My partners here in Austin, we were ecstatic and very excited about even having this opportunity to be a part of this endeavor.
Speaking on behalf of Paige and all of our consultants, we have immense pride in being involved with this significant project and bringing world-class care to Austin.
The hospital started with a vision imagined many years ago by Texas Children's leadership, which is now becoming a reality through the meticulous effort of countless employees, physicians, designers, construction professionals, and others who have designed and planned every detail to bring the state-of-the-art facility to North Austin.
And people seeing the opportunity or having the opportunity to be a part of this project, they were very excited, and we had no problem bringing in very talented and hardworking people to the team.
And personally, it gives me additional motivation and commitment to delivering the project as fast as possible.
Paige has been working alongside Texas Children's in their move to Austin, first with the urgent care at West Chase, and now a full campus.
We all see that having such a prominent player in pediatric medicine to be a part of our community here in Central Texas was a major attribute and a positive thing for our community.
This project also benefits craft workers and small businesses through the job creation and training opportunities, ultimately leading to growing the talent and capacity of our small business partners.
Not only are we thrilled professionally, but we are so happy to bring the care that we are accustomed to here in Houston to our neighbors in Austin.
And every step we've taken to bring this care to Austin is helping us serve the state of Texas even more successfully and allowing us to truly be Texas Children's Hospital.
We're excited and honored to serve you and your family at our future hospital campus in North Austin, and we can't wait for 2024.